Community and Public Health by Roger Hunter. Community and Public Health. Community and public health can be summed up as the well-being of a population. Community health and public health has always been a major concern of humanity. History has shown that negligence and failure to acknowledge how the health of others, whether it has been in small communities or large scale, can have large consequences, good or bad. The study of the causes and preventive methods of infectious disease has helped us to understand the relationship between community health and public health and aids us in the efforts to promote a better future and healthy lives of others. Since 1900, life expectancy has increased from about 49 years old to 78 years old in 2008. Community health is defined as the study of the health and the factors that affect a group of population. Public health is rather the study and the science of health outcomes of the general population and the things that influence the health outcomes of society. Public health considers not only what causes disease, but a makeup of the research and studies that lead to the prevention of adverse health outcomes, control of communicable diseases, education, and the organization of effective and efficient interacting of resources that work together to create a culture of health that promotes the healthy lifestyles and good health of all humanity. The role of community health. Community health is defined as the study of the health and factors that affect a grouping of population. Community health is limited in its scopes as it provides analysis on a grouping of population rather than a whole generalization of a group of population. For example, community would consider the study and potential causes of the infant death rates amongst minority groups in Louisiana. The practice and quality of services varies from location to location, and every community has its own unique influence. Because of this fact, community health takes an approach that is more personable to a specific population to understand the causes of health outcomes and the contribution of multiple level approaches to prevent and educate the population about the disease. The role of public health. Public health is rather the study and the science of health outcomes of an entire population and the things that influence the health outcomes of society. Public health considers not only what causes disease, but a makeup of the research and studies that lead to the prevention of adverse health outcomes, control of communicable disease, education, and the organization of effective and efficient interacting of resources that work together to create a culture of health that promote healthy lifestyles and good health. The study of public health also acknowledges the social aspects of healthcare, such as focusing on the population that are most affected by adverse health outcomes. The organizational structure of public health. There are three core principles of public health. These core principles include the assessment, policy development, and the assurances of healthcare initiative. The health assessment phase of public health is conducted through collection and analysis of data that show the occurrence of infectious disease. Once these health occurrences and causes are evaluated, public health policy are designed to help improve the health outcomes of the selected population. The policies are developed on a local and state and federal level through laws, regulations, and community support. Once policies are in place, laws are enforced, the public is educated, and workers are trained and process of evaluation for effectiveness and efficiency of programs exists. Funding. Funding is perhaps one of the most key factors in between the desire to change and actual change. Research and the total implementation of laws that are established to aid in the prevention and the promotion of health cannot flourish without the procurement and granting of funding. Funding for programs that aid in the prevention and the promotion of health programs occur through many interfaces. Some programs are funded through the government programs such as the Medicaid and Medicare, while some programs are funded through charity organizations such as the Ron White program, and others are funded by local and state grants such as WIC. The establishment of the Affordable Care Act has aided in the expansion of healthcare coverages through private and government sources. In conclusion, as Americans, we are living longer lives, and the occurrence and opportunity of illness and disease occurs at a rapid rate. Despite success in the past, healthcare incidences that have once been considered eradicated has made such a comeback in recent years. Despite our many advances in healthcare, society is still faced with ethical issues such as the cost and affordability of healthcare, access to healthcare, and healthcare disparities that occur at more prevalent rates in one population than other, depending on socioeconomic depression. Real positive impact on the outcome of healthcare, whether it be in local communities or public populations, occurs through the collaboration efforts of a wide array of policies, departments, agencies, and interest groups that work together to understand the occurrence and causes of disease. This concludes my presentation on the community and public health. Thank you for watching.